Welcome back to Winging It Buffalo Style. Today in our health segment, we're learning more about a serious disease that affects thousands of men right here in Western New York. We're joined by Dr. Thomas Schwab. You're a urologic oncologist at Roswell Park Cancer Institute, and you're here to discuss Testicular Cancer Awareness Month. So, Dr. Tom, of course, thank you for being here. You know, this is a topic that for a lot of men is going to be a little bit awkward to talk about, especially when we start to talk about the age range that it affects, because it's the leading cause of death from men from 15 to 35. So for people that want to start having this conversation, where do you start?
Well, it is a very common cancer in younger men. And I would start the conversation with, you know what, there's famous people that have had testicular cancer. For example, Lance Armstrong. You know, he had actually metastatic testicular cancer that had spread to the lungs and other parts of the body. And, you know, that's how you start the conversation, and you're just being open and honest about it.
So do we have any information about why it affects men as young as 15 or even younger?
We don't really know, to be honest with you. It probably has something to do with the fact that that tissue still develops at that age. But it is what it is. Testicular cancer is a cancer of the young man, somewhere in the mid to late teenage years to mid to late 20s. And then actually is another higher rate of testicular cancer for men in their early 40s sometimes.
So when we're talking about, I know that every case is going to be different, but typically what path happens? Where does it go when you're diagnosed with testicular cancer? So
the diagnosis actually happens by the patient himself most of the time, or somebody who is close to that patient, by self-exam. You know, somebody finds a lump in the testicle in the scrotum, and the next step is to go see a doctor and confirm that diagnosis. There are other things, other reasons to end up with a lump in the scrotum, like a hernia, for example. An ultrasound is performed, which is a completely non-invasive test, just a little bit of lubrication jelly and the ultrasound probe, and that confirms that there truly is a mass in the testicle. And by definition, when there's a mass in the testicle, that is a testicular cancer until proven otherwise. Now, the only way to prove that is by seeing a urologic surgeon. I'm one of them, and the testicle is removed. It's very rare that we only remove part of the testicle, because we really need to get the entire cancer out. The reason why it's important to see a urologic surgeon fast after the initial diagnosis is because testicular cancer can spread rapidly. And when it spreads, it usually spreads to the backside of the stomach, what we call the retroperitoneum, or the lungs. The thing with testicular cancer is that it is highly curable if you are treated appropriately and managed appropriately by what we call multidisciplinary team, where you take surgeons, you take doctors who give chemotherapy, and sometimes doctors who give radiation therapy.
Now, do you think because this is kind of an uncomfortable situation for a lot of men to be in and maybe talk about, that prevents them from going in as soon as they should go in?
Yes, there are actually, I think, in my mind, two reasons why men don't seek medical help in that situation. One is clearly they're afraid, shy, you know, there are inhibitions to that, and the other reason is healthcare coverage. You know, some men don't have healthcare coverage, and they're worried about the costs associated with that.
And then real quick, we're running out of time. For more information, where can people go? How can they contact someone that could walk them through all this?
Yeah, absolutely. Either our website at roswellpark.org or 1-877-ASK-RPCI.
All right, again, thank you, Dr. Thomas Schwab, for coming in and shedding light on this very important subject.